Topic I'm going to be discussing is the stigma surrounding borderline personality disorder, commonly referred to as BPD, a mental health condition that's often misunderstood, misrepresented, and judged. I'll explain what BPD actually is, what it's not, and how we can shift the way we talk about it. I hope to bring awareness, challenge harmful stereotypes, and help create a more compassionate understanding of the people who live with BPD every day. What is borderline personality disorder anyway? BPD is a mental health condition that affects how a person thinks, feels, and relates to others. According to MayoClinic.org, it includes a pattern of unstable, intense relationships, impulsiveness, and an unhealthy way of seeing themselves. People with BPD often experience extreme emotions, or react without thinking. One of the most common symptoms is a deep fear of abandonment. Even though they may want loving, lasting relationships, that fear can lead to mood swings, anger, impulsive behaviors, and self injury. Borderline personality disorder doesn't just come with difficult symptoms, it also comes with heavy stigma. People with BPD are often seen as manipulative, unstable, or even dangerous, but these assumptions are wrong and incredibly harmful. People with BPD often think in black and white, like everything is either all good or all bad. There's usually no in between. This kind of thinking can make it hard to handle conflict or change, because one small issue can feel like the end of everything, and one kind action can feel like total safety or love. It's intense, and it can cause a lot of emotional ups and downs, especially in relationships. One of the hardest things about BPD is the emotional intensity. Moods can shift quickly from feeling okay to feeling completely overwhelmed in seconds. In relationships, that fear of abandonment can lead to pushing people away just to see if they'll stay. There's often a pattern of arguing, then suddenly reconnecting, what some call a love hate cycle. According to the Mayo Clinic, the causes of borderline personality disorder aren't fully understood, but there are several factors that may contribute to it. One is genetics. Some studies suggest that personality disorders can run in families and may be linked to other mental health conditions among relatives. There are also changes in the brain, especially in areas that control emotions, impulsivity, and aggression. A hereditary predisposition may increase your risk too, meaning if a close family member, like a parent or sibling, has BPD or a similar condition, your chances could be higher. And one of the biggest contributing factors is a stressful or traumatic childhood. Many people with BPD report experiences of abuse, neglect, separation from a caregiver, or growing up in an unstable or hostile environment. So while there's no one cause, it's often a combination of biology, environment, and life experiences that shape the development of BPD. The borderline personality disorder, even professionals sometimes treat it differently. A Time magazine article once called it the disorder that doctors fear most. Imagine how that feels to already be struggling and then feel like the people meant to help you are afraid of you. Perry Hoffman, who helped found the National Educational Alliance for BPD, said this illness carries so much stigma that its name is often whispered or avoided completely. He called it the leprosy of mental illness. That's how deep the shame and misunderstanding can go. This kind of stigma doesn't just hurt feelings, it stops people from getting help, from opening up, and from feeling like they matter. But there is help for people with borderline personality disorder. According to choosingtherapy.com, treatment for BPD often includes a combination of therapy and, in some cases, medication. The most common and well known treatment is dialectical behavior therapy, or DBT. It helps people with BPD build skills to manage their emotions, improve relationships, and cope with distress in healthier ways. DBT also focuses on creating a validating environment and encouraging strong patient-therapist relationships. Other effective approaches include cognitive behavioral therapy, which targets harmful thought patterns. Mentalization-based therapy helps individuals reflect on their own thoughts and better understanding the mental states of others, and transference focused therapy, or TFP, uses the relationship between patient and therapist to explore how a person experiences emotional connections. Medication isn't a cure for BPD, but it may help reduce symptoms like anxiety, impulsivity, or depression. With time, the right support, and consistent treatment, many people with BPD go on to live stable, fulfilling lives. What can we do? We can understand that borderline personality disorder isn't something to fear. It's something to understand. It's complex, emotional, and often misunderstood. But people with BPD aren't broken. They're human, and they deserve compassion, not judgment. BPD is treatable with therapy, support, and patience. Many people go on to live stable lives. The stigma surrounding this disorder doesn't just hurt, it isolates. But the more we talk about BPD, the more we can change how people see it and how people with BPD sees themselves. Thank you for listening and for being open to understanding something that many people still get wrong. Together, we can break the stigma. Included two interactive ways to help you reflect on what you've learned. The first is a short survey. Your honest answers will help show how understanding around borderline personality disorder can shift once we replace judgment with education. The second is a quick word search. Take a few minutes to participate if you can, because when we stay curious, stay open, and stay involved, that's when real change starts.